Well, the number of people with asthma has more than doubled in the last 30 years, with a significant number of kids among the new cases. Allergy season can make the struggle to breathe even worse, and that is why the experts at Ohio ENT and Allergy physicians are so involved with asthmatic patients. So Dr. Roger Friedman is joining me again today with the link and the new treatment options and all this good stuff that we're going to help people with, right?
There is a lot of good stuff going on now. You never say it's a good time to have a disease,
Sure.
but if you're going to have asthma, now is our best time in history. We have better treatments, better diagnosis, and for the first time, what I'm going to call personalized health care. We have a better way to better individualize care in patients. So we can come up with a treatment that will help the individual patient specifically.
And why do you think it has gone up so much? Why are we seeing these numbers?
So there's a lot of theories, but the big one has to do with what we call the hygiene hypothesis.
Okay.
Hygiene hypothesis means that because we're actually cleaner and healthier, and that's good, and children get less diseases early in life, they get immunizations, vaccines, we don't live in a farm animal environment anymore. Because of that, it actually has made us more susceptible to allergies and asthma. So it's kind of a dual-edged thing. We're not getting measles, mumps, rubella, hepatitis, malaria, but we are getting asthma and allergies.
And so how many kids are being affected by this? Because that's when you start them on treatment, right when they're younger.
Yeah, it's a big number. Roughly 9% of the population, so over 27 million Americans have asthma, and of those, about 15 million are children.
And so when they have an asthma attack, because that's when things can get scary, so what are the most common causes of that? Are allergies a big part of that?
So allergies are a huge part of asthma. Allergies, number one, can cause asthma exacerbations, asthma attacks, but more importantly, they set the stage for the attack. That if you're allergic and have asthma, then your allergies make you more susceptible to an exacerbation and a problem when we have the attack. And then when you get usually a cold, a virus, that will push the patient over the edge and have the acute bad event.
So now that we know there is a link between these two things, so when you see a patient for allergies, you're now kind of, having to treat them for both, right?
Well, sure. The allergist has been one of the main doctors taking care of asthma for 100 years. We've known about this link, and we know that about 80% of children who have asthma will have allergies. And if we can make their allergies better, we can make their asthma better.
Okay, so what are some of the new treatments at your disposal?
So the new treatments, number one, is a new way of diagnosing asthma, a new test we call the exhaled nitric oxide. ENO is very specific. It measures inflammation in the airways. And if we have eosinophilic inflammation in the airways, those are patients who most likely have allergies, and those are patients who will respond best to inhaled corticosteroid medicines, and they'll respond best to allergy shots.
So how do you know if a person with asthma is going to respond to these? Do you just try it out, see if it works?
And that's kind of the old approach. And
Okay.
we still have to do that a lot. But if we know, again, if we do an ENO or we do a simple blood test, an eosinophil count, if we find out that it's low, the eosinophil count, then we know the traditional steroid medicines won't work.
Okay.
In those patients, we may use medicines like Singulair and other medications.
So what are some other kind of ENT, ear, nose, throat disorders that can affect asthma?
Yeah, that's a good question. It's one of the reasons why we had our merger of Ohio ENT with the allergist, is that two diseases in particular. Sinusitis is one of the main triggers of asthma.
Okay.
And so we collaborate with our ENT physicians and try to diagnose sinusitis better and treat it better, either medications or, when needed, surgery. There's another condition, vocal cord dysfunction, that mimics asthma. In a vocal cord dysfunction, the patient has problems with breathing, but it's actually their vocal cords and not their asthma. When we suspect that, and it's oftentimes in an elite athlete, usually a teenager, who suddenly is getting short of breath all the time. And it could be their heart, it could be their lungs, but many times it's vocal cord dysfunction. We'll have our ENT colleagues take a look down at their vocal cords. They can actually demonstrate the abnormality, and we can oftentimes get patients off of asthma drugs and make them better.
So it is a lot about that team approach that you guys do. I mean, that can help tremendously.
Tremendous collaboration, and especially when, again, as we're a big group now, we can easily send the patient over to the ENT to find out about that, and vice versa. If they find a patient who has sinus disease, many times it may be allergies triggering that, and we can give a proper diagnosis and maximize and get better treatment.
Okay, so now that you know, you got to get the testing, you got to get in, find out what's wrong in order to be treated. So go to Ohio ENT and Allergy Physicians website, phone number, all that good stuff on screen. So thanks, Dr. Friedman, for being here.
My pleasure.